It starts off innocent. Many begin taking opioids, not realizing they're a highly addictive narcotic prescribed by doctors to treat persistent or severe pain. But that need to feel better has quickly turned into addiction.
This is a drug problem.
On average, 130 Americans die every day from an opioid overdose.
And then once I found opiates, that was the end of it.
Maryland is mourning those deaths. There have been significant increases in drug overdose deaths, with opioids to blame for nearly 70% of all drug overdose deaths. Whether you feel it or someone you know feels it.
I mean, you don't give up on your kids.
Maryland has a problem with pain and drugs that's now turned into an epidemic, an opioid epidemic. This is a Fox 45 News Town Hall special, Ending the Epidemic. Hello, and thank you for joining us for this Your Voice, Your Future Roundtable Town Hall. We're speaking about an issue that touches everyone's lives, opioid abuse. Joining us today is Dr. Joseph Foscaldo, Medical Director of Quality at GBMC Hospital, Harford County Sheriff Jeffrey Gaylor, Dr. Gregory Branch, Baltimore County's Director of Health and Human Services, and Mike Gimbel, host of Straight Talk, which airs right here on our sister station, WNUV. Thank all of you for joining us.
Thank you for having me.
Dr. Foscaldo, let me start with you first. As opposed to just this negative narrative, tell us what opioids were intended to do. Under a clinical situation with medical supervision, these drugs legally can be used for a good purpose. Is that right?
Absolutely. And when many of us trained, we were being taught about that many physicians were undertreating pain. And these drugs, as you mentioned, medications are so effective in people that have long-term serious pain, things like cancer pain. The problem, though, is it's quickly grew into other uses that, unfortunately, we didn't really have great evidence for, but it was a quick bandwagon, and it was a lot of momentum was shifting, and a lot of different reasons shifting us to do that.
Yeah, Mike Gimbel, for years you have been hosting Straight Talk, but even beyond that, you have been an advocate for ending drug abuse in general, whatever that drug might be. How have you viewed this shift of opioid abuse?
Well, you know, heroin's been around for a long time. I was addicted to heroin in 1970, and I finally got off a few years later, been clean almost 47 years.
Congratulations.
But what we've seen is this kind of coming together of all the bad things that can happen. We started seeing doctors overprescribing. We started seeing more people developing addictions from the streets. Heroin quality was getting better and better at the same time. And normally, if that would have been the case, you know, we would have seen a slight increase. But what threw everything off was fentanyl. And when that hit the scene, you know, that just took over. And, you know, when you talk about a little pinhead full of a drug that can kill you, and now you've got all these addicts out there that are experimenting with heroin and opioids, all of a sudden they start dropping and dropping quickly. And so we've been dealing with that phase of fentanyl, which now is the drug of choice of the addicts on the street. They literally ask for fentanyl, and the dealers are selling fentanyl. So we've gone from a drug that scared everybody away to addicts now who actually know how to use it better.
Right.
So they're not overdosing as much as they were 6 months ago because they're known, and that's addict behavior. That's what addicts do.
It's kind of a scary proposition, too. Dr. Gregory Branch, could you explain the differences between heroin and opioid, fentanyl, which Mike Gimbel just mentioned, and, for instance, oxycodone, a pill that many people, or the ingredient in a pill many people are familiar with?
So when we're talking about these drugs, we're talking about opioids. And opioids, to a certain degree, work the same as it relates to our bodies and our brains. The difference between them from the perspective of folks dying is their potency. So what you're going to get is some drugs are going to be more potent than others. So yes, heroin is potent, but fentanyl is much more potent, and carfentanil is more potent than fentanyl. So when you're looking at a drug like heroin, I can have much less than 1/100th of that of fentanyl that would kill a person, and then 1/100th of that of carfentanil. Fentanyl is a drug that was used to put down a large mammal, like an elephant or a rhinoceros. So you can imagine what that can do
In the
to a
human
person.
body.
Yes, exactly.
And where is it coming from?
So what happens at this point now, we're going to have to ask the sheriff about the specifics of where these different drugs come from, but they come from across different countries and stuff like that, and come to different parts of the United States.
And Sheriff Gaylor, I understand that some of these drugs, and I'm not trying to point the finger solely at this country, but a lot of the fentanyl we've heard is coming from China. Is that
Absolutely.
accurate?
And that's what any of the experts will tell you, that the synthetics, the fentanyl, the carfentanil, come to us, and our postal service is used against us. The dark web, part of the internet's used against us. Bought, delivered here in our country from mostly China, does come from other Asian countries, and we see some come up from the south through Mexico, across the border into the country. And when it was heroin, as you heard and discussed, it was all coming in from south. It was coming in from South America, through Mexico and into our country that way. But since they have really, those suffering from addiction have turned to the synthetics, and as Mike said, that's what we see. We see, and we have talked to people who have survived overdoses, and it changes the mindset, and the doctors can speak to addiction, but it changes the mindset so that these individuals are going out and trying to find the buyers who they know someone died from the use of their drug.
Right.
Because they want that more potent, they want that stronger hit that person's selling.
Mike Gimble, you had a question. I want to get this in real quick as you follow up. From Sheriff Gaylor's point, is it street cred, if I'm a dealer, is it street cred for my drug that it killed somebody because now people want to chase that high?
Oh, absolutely. And not only the people, but the dealers they're selling fentanyl. Before they were selling heroin laced with fentanyl. Now they're straight out selling fentanyl. And again, the addict wants the most powerful drug they can get their hands on. They're not afraid of dying or overdose or AIDS or hepatitis. They want the best, and they want a lot of it as much. An addict, in my heyday, I used to have to shoot up 3-4 times a day. A day.
And that was just heroin, right?
That was just heroin, and that wasn't even that good back then.
Right.
But the mind of the addict is, I want more, I can never get enough. They never save anything for tomorrow.
Right.
So the fentanyl now is all over the streets. We're also seeing a big increase in cocaine being mixed with fentanyl, known as a speedball, which killed John Belushi. Everyone remembers that. So it's important. I just spoke to a DEA agent just a couple days ago who told me that the new fentanyl that's coming into this country, the synthetic fentanyl, that most of it is coming up through Mexico. They're actually making it themselves, and China has kind of dropped off because a lot of pressure being put on by the president and China's president.
Interesting.
And now they're literally setting up labs in Mexico and selling fentanyl right over the border.
Right, and some of that could be tied in with the border crisis. I want to mention this, and Sheriff Gale, I have another quick question for you. So the CDC reports from 1999 through 2017, almost 400,000 people died from an overdose involving any opioid. Really staggering statistics. Sheriff Gale, there's a public safety standpoint for your men and women in uniform who might go to respond to a person who's had an overdose. Am I right? Where fentanyl is concerned.
And we had an incident with one of our corporals at a scene, and we went out and purchased, as many police departments and first responding fire departments have, protective equipment. So when they go into these scenes, it's more or less a hazmat machine, because when you're trying to protect your deputies who are in a scene where someone has overdosed and there might be fentanyl or carfentanil there, we're going to equip them to do that as safely as possible. And we have in Harford County, and I think most of the police departments have as well. It's a scary day for our men and women in law enforcement.
It certainly is.
And EMS responders who are providing care.
Dr. Fiscaldo, walk us through, if you can, just briefly. I'm a parent. Maybe there's somebody in my house. I didn't know it. Working on this. Maybe there's a mini lab, anything. What might I notice about myself if I walk into a situation that could be potentially deadly, that I should get out and call a hazmat, the fire department authorities, so they can come and tackle this?
I mean, in terms of
what would happen to the body? How might I know that I might be starting to experience a poisoning from fentanyl?
Sure. The opiates themselves will cause a lot of changes in the body, including relieving pain, but they will also cause, at higher doses, decreased breathing rates and relaxation and almost putting people into a stupor.
Is it fairly quick?
It can be, and particularly the IV method that is preferred by many addicts is very, very quickly, gets into the bloodstream very, very quickly. People who are have tolerance can obviously handle, their body is used to it. Unfortunately, someone who is not used to it maybe goes to a party the first time, and they're going to be even at higher risk. And I think, you know, we all need to be on the lookout. There can be, in addition to being sort of a low level of consciousness, pupils can change and constricted. The breathing rate slows down, to the point where you have trouble arousing someone.
Right.
So those are all concerns.
Please, Sheriff Gaylor, the doctor's comments.
Go ahead. Yeah.
You know, all of our deputies, and there's so much Narcan, naloxone out there. I know I don't pronounce that correctly, but it's out there in the community. So if you have a suspicion, administer it. If you have access to it, because you can't go wrong. Could be a heart attack. You're not going to hurt them any worse. Sure. But if it is an opioid overdose, it's going to, and we see it all the time when we administer it, the deputies administer it, that it brings so many people out of that overdose.
All right, Sheriff Gaylor just mentioned naloxone and Narcan. They are opioid reversal drugs for someone who's had an overdose. Mike Gimbel, you're not disappointed those drugs are on the market, but you're concerned they enable addicts.
Well, my concern is that when it comes to Narcan, it's a miracle drug. There's no question about it. Doesn't change the behavior of the addict, but with fentanyl, what we've been telling the public is keep your Narcan, use your Narcan. 1 or 2 or even 3 hits of Narcan won't work on fentanyl. And the paramedics see it every single day, yet we're telling the public, keep your fentanyl in your purse or your pocket. I mean, your Narcan in your pocket. That scares me because it's giving people kind of a false sense. So what I tell people is, if you see someone who's overdosed, first thing you do is you call 911.
Right.
Then if you want to give them the Narcan, fine. But get a paramedic there because they've got a supply of Narcan on their wagon where they can really help somebody.
And enough of it.
And I don't like giving that false sense. The other part of it is I think we've gone so far with the Narcan that we forgot that once you bring them back, then what?
Right, then you have to do something.
Then what do we do?
Hold that thought, because I know where you're going next, because this is something you talk about a lot. I want to get Dr. Branch in here quickly. Dr. Branch, can you tell us, what do we know about stats of opioid addiction in Baltimore County, because that's directly under your purview?
So in Baltimore County, we do have an issue. I will say that there are many people.
Epidemic?
An epidemic, and people are suffering from this disease. And I want to keep saying disease. These are people who are affected by a disease, and we need to treat them for that. So
whether it's alcoholism
or diabetes or whatever,
it's a disease.
It's a disease. I think it's very important that we say that, and I want to be able to bring it out here because I don't want to have the people who are suffering from this disease to feel ostracized in any way, shape, or form. If I was a person who had diabetes and I decided that I was going to go and I was going to have some McDonald's and fries and a big gulp soda, and now I ended up in the hospital with a very, very high sugar, the first thing that they would do is give you what? More insulin to treat the disease. Just because I'm a person who has a substance use disorder and I decided that I was going to take another drug, right? I still need the drugs for the treatment of my disease. We have to understand that it's important that we get those drugs. I am a huge proponent for Narcan, because Narcan gives a person another chance. If I don't give the Narcan, the person will potentially die, and then I have no other chance for that person.
Mike Gimbel's good. I'm going to get him in here for a second about this. One of the things he consistently talks about, he's lobbied for this, and you consistently hear from addicts is there's not enough treatment. What kind of treatment do we have in Baltimore County for people who want to get off the addiction, for people who have family members and loved ones they're trying to help? What's the treatment look like in Baltimore County right now?
So at this point now, we're getting ready to open up a treatment bed facility at the Rosewood site, and that'll be opening up probably in the next 12 to 16 weeks.
How many beds there?
It's going to start off with 30, and then we'll end up with hopefully approximately 80. But we also have other treatment modalities. You have other treatment centers, methadone clinics. You have physicians who are giving buprenorphine. I got multiple peer recovery specialists who are out there. And so what we've seen is with our Narcan and our other reach tools that we use, we know that for the first quarter of 2019, that we were able to see a decrease in the number of opioid deaths in Baltimore County at about 30%. So we know stuff is working for these folks, and we've got to be out there to be able to treat this like the disease it is.
Dr. Fiscaldo, I'm sure you see a number of people who come into GBMC from overdoses and things of that nature. Once you've treated them initially, are you able to get them help long term to break the cycle of addiction?
So we certainly try, and you know, sometimes it's frustrating if the person's not ready or declines treatment. But we certainly try to enroll them into a program because, as you mentioned, getting them over the initial the event is just the first part, and you know that it's going to be a long-term disease. We know now that the information, the studies for Suboxone are very promising in that withholding or for us to not offer these kind of treatments to people would really be not the standard of care. So we need to do a better job of that. The physician communities, not enough of us are comfortable prescribing these medicines, and some of that is bureaucratic. It's very interesting. Any physician can prescribe as much as they want of the opiates, but to prescribe one of these other agents, you have to have a special training, a special license.
Is it too much red tape?
In my opinion, there is.
Yeah.
Kai, this is where we go
Please, go ahead,
wrong.
Mike.
This is, I mean, this is where we missed the boat, okay? Because here's the deal. We don't have enough treatment. I don't care if it's Baltimore County, Baltimore City, State of Maryland, United States of America. We don't have enough treatment. We need treatment on demand, regardless of their ability to pay.
Right.
For everyone, whether they overdose, whether they end up, you know, a family member, we don't have it. And we're not putting our money into treatment, especially here in the state of Maryland. We're getting millions and millions of dollars from the federal government. We're going to get probably more money from these lawsuits. And what we're doing is we're buying TV spots and hotlines and crazy stuff. We need every dollar to go into treatment because as this epidemic continues, we'll see overdoses drop because, again, the addicts, you know, are getting smarter. Addict population's going up higher and higher. They don't all overdose.
You're saying they're learning how to survive.
They survive. They learn how to use the drug. So the addict population grows. We've got no place to send them. You know, I'm talking about residential, long-term treatment.
Why do you think there isn't enough treatment?
We're
There's
not
a
going
reason for that.
Let me finish this. We're not going to solve this drug problem, even though you say it's a disease, and it is, and we've been trying to sell that for years. You don't treat a drug problem with more drugs to an addict. It doesn't work. Whether buprenorphine or Suboxone,
how do you treat it?
They don't block all the receptors.
Right, but
so
how
the
do you
addict
treat
can
it?
still
So I'm
get
asking you, tell
to
our
me,
viewers.
you get them off the street into a residential setting for 3 months, 6 months, 9 months, but they've got to get out of their environment. The environment's got to be 80% of why people relapse. So we get them, they overdose, we go to the hospital, they ship them back to the same neighborhood, just like people coming out of prison. We've got to have residential programs, and we've had residential programs. Dr. Branch talks about opening the program at Rosewood. Well, it was there for 25 years, and the county closed it. Nobody knew why. Now they're going to reopen it. Terrific. We're thrilled with that. But the reality is we've got closed mental health facilities, empty Army bases. Why aren't we putting money into what we know will be effective rather than just trying to look good on TV? That's the problem.
Well, that's a question, and we need to have that question answered. Mike Gimble has a point, Sheriff Gaylor, in that this is very similar to the recidivism rate. That is, you go to prison, you serve your time, you come back, you go back in the same neighborhood, you start doing the same things. Drug addiction is very much like that.
Sure.
And I'm sure you see a lot of repeat offenders.
Oh, we do, and we actually had a press conference today related to a program that we're doing to try to lower recidivism rates at the Thrive program, which has elements of the opioid treatment, our substance abuse unit at the detention center, doing much of what we've discussed here on the couch, trying to steer people toward treatment and a path of recovery.
And isn't part of the problem that Mike says, and Mike, you didn't bring this up, but that drug addiction has been criminalized. And so people who are addicts, if you break into the car and bust somebody upside the head, you're going to go to jail for that. People understand that, but the addicts aren't getting treated for the disease.
Right, and I'd say in Harford County, we've done a lot of different things on the opioid epidemic. One of the things, and we now have district and circuit court level opioid courts. So if there's someone who has committed an offense like that, first, if you overdose, the Good Samaritan Act is going to protect you. So I don't want anybody hesitating on calling 911 if there's an overdose in fear of getting arrested. You will not be arrested. Maryland has the Good Samaritan Act. Our enforcement efforts are targeting the dealers. But when you get into the criminal justice system for other offenses, you're stealing to support your habit. A lot of people we don't want you to go to jail. We don't want to get a record. I look at it much like we've talked. I want to save them. I want to first have them alive. And through our detention center, we are now offering different programs, our substance abuse unit being one of them, where it's an intensive 10-week program the person comes into. We can't offer it to every inmate, a daily population of about 400, but we screen them to see who we think we can make the most, working with our healthcare partners, the health department, and our medical provider, and try to target those who we think we can have an impact on.
Sheriff Gaylor, from a criminal standpoint, how big is the sale of opioids?
Oh, it's huge, and we chase dealers. I've made no secret of the fact we'll chase dealers wherever we need to. A lot of our cases lead back to Baltimore City. If you talk to the sheriff from Cecil County, he'll tell you his source city is Wilmington, Philadelphia. That's where their drugs flow down from. But we've targeted dealers, and we've been very successful. I think at one point, I don't know if it's still the case, we had more federal prosecutions because they can look at stiffer penalties. They can get a 30-year sentence in the federal system for dealing an opioid that results in a death. And I think that's what's needed, because we know there are dealers out there who wouldn't touch this stuff in a million years. They're not suffering from addiction. They're profit-driven purely, and they don't care what lives they impact.
But I need to go back to this whole idea of the disease process, because it's very important for us to understand that irrespective of what type of disease that you have, there's a waxing and waning process, and also people will fall off the wagon. So if a person has hypertension, they don't stay away from every grain of salt. If a person has diabetes, they're going to go back and cheat a little bit. The same exact concepts happen with a person who suffers from opioid addiction. One of the things we have to understand, and we've got to remember, we have basically scandalized their names by putting them on the outskirts of our communities, by calling them different names and making them seem like they're bad people. We sit here at this table and call them addicts, which is a harsh term. These are people who suffer from a disease.
The disease of addiction.
A disease of addiction, a disease, looking at them and saying to them, I understand that, and being able to be there.
But either way you look at it,
I agree with you.
Either way you look at it, Dr. Branch, the bottom line is this. Whether you have the disease or, if you can't help somebody, if you can't get somebody into treatment immediately, you lose them.
And that's what I was getting ready to say.
And that's what happens.
I think what the point here is...
We're not investing the money that is coming down from Washington into this state, into your county, Baltimore City. We are not investing. We had the state's attorney yesterday go to Washington, where she had an opportunity to fight for money for treatment in Baltimore City where we need it. And she talks about safe injection sites and legalizing marijuana. We're so off track here. And let me say this also. The disease, we're into the medical part of this thing. An addict is an addict, and that's what they are, because they are addicted to that drug that drives them to do things they would never do in their entire life. The things I did as an addict, just horrible.
But let me just stop for a second.
Just got a point. We don't think about people with heart disease the same way.
You don't treat it by thinking they're going to take a pill that's going to stop them from being an addict.
I want to bring up what you had said before, Kai. You had asked a question, which is a very important question. Your question was, how do you know that we don't have enough treatment facilities? And I was going to say that I agree with Mike Gimbel in that you need treatment on demand, and that's how I can tell you that we don't have enough treatment.
I got to get Dr. Fiscaldo in here. We cannot miss the point. Wherever we're talking about the fentanyl coming from China, Mexico, wherever it's coming from, the role of Big Pharma in all of this, because there's been a big discussion about this, and federal agents have publicly said they've been hamstringed by Congress not to prosecute. What role should Big Pharma have in terms of being responsible, in your estimation, Dr. Fiscaldo, and perhaps then contributing money to correct some of the problems that we're seeing today?
I don't know if I should render opinion on how much they should financially respond, but they were clearly involved in the genesis of this problem. And as it grew and grew, 1 in 17 patients who are prescribed an opiate after surgery end up being addicted. One of the reasons this 1 in 17 of opiate naive people will go on. We've done a lot of efforts to start to change that and to try to lessen. Unfortunately, so many teenagers find somebody else's prescription in their medicine cabinet, and that's how they get started.
That's the gateway for a lot of teens, isn't it?
But it really has to be a culture change, and we have to go at this from many different directions. And I think there is being slowly starting to shift, where I used to see patients coming in and saying, "Oh, doc, I have pain. Can I try some Percocet?" I tried my cousin's Percocet or oxycodone. Now we're starting to see a change of, I don't want any of that stuff. I've heard bad things. Can I get by with ibuprofen?
Right. Sheriff Gaylor?
I was going to say, I know what Mike has said, that there's more addicts out there and they're using better. I know we're seeing a decline in numbers. We're seeing it across the state. We saw it in Harford County for last year with less deaths than the year before. And I got to take those as positive signs. That I think that our education is starting to pay. I think the treatment rates are increasing. At one point I heard it was 4%, meaning you're losing 96 out of 100. It's got nowhere to go but up. So I think those efforts, and I think what we talked about, somewhere to go, is so important. And our county executive, working with the state and the partners at Upper Chesapeake Health and the community, just opened the Klein Family Crisis Center 24 hours. So we have beds. We have somewhere to take a person, and that's what we were lacking in our fight for sure, a place to immediately take that person if they are seeking help.
So we had an epidemic, and the epidemic we're talking about now are deaths. But we had an epidemic since the 70s,
sure, yes.
And you've said that clearly.
Yes.
So what happens is the fact that people are dying, and I think that we're getting people that are not dying as much. However, I can't tell you, because the deaths are going down, that the folks who are addicted are going down also. I couldn't tell you that.
We've got to look,
treatment.
we have to look at addiction versus the death, because it kind of, if the numbers come down, people will think, oh, it's over. But no, there are more people addicted, more people out there watching the show who need help. They need it quickly, and we need to get it for them.
Get them help. Okay. Thank you, gentlemen. I appreciate it. Dr. Fiscaldo, Sheriff Gaylor, Dr. Branch, Mike Gimble, we appreciate it. Thank you for watching. We didn't solve the problem today, but it's an important discussion. And if you need help out there, there are places you can turn. We want to remind you that if you're suffering from addiction, and you know someone who is, or you'd like to learn more about how you can help, call 211. This has been a Fox 45, Your Voice, Your Future Roundtable Town Hall, ending the opioid epidemic. Thank you for watching.